Today we're talking about a fruit that seems totally harmless, but can secretly mess with your medicine. Grapefruit. Now, I know grapefruit looks like a healthy choice, right? It's fruit, it's colorful, it's loaded with vitamin C, but here's the twist. When you mix it with certain medication, grapefruit doesn't just taste terrible, and I know that's subjective, but it turns into what I like to call the juice of doom. Okay, that's a little dramatic, but here's what's going on. Inside grapefruit are natural chemicals called furanocoumarins. Now I know that's a big word, but what they do is simple. They block an enzyme in your gut called CYP3A4, otherwise pronounced CYP3A4. Now, I know what you're thinking, but this has nothing to do with Star Wars. That was C3PO. This enzyme is like a bouncer at a club. It controls how much medicine actually gets into your bloodstream. When grapefruit blocks that bouncer, more medicine rushes in. So instead of the usual dose your doctor planned, your body might get 2 or 3 times the amount. Too much medicine equals more side effects. So let's go through some of the common medicines where grapefruit causes this kind of trouble. Cholesterol medicines. So drugs like atorvastatin, which is generic for Lipitor, simvastatin, generic for Zocor, and lovastatin, which is generic for Mevacor. With grapefruit, these can build up and cause muscle pain, weakness, or even serious muscle breakdown. So if you're trying to lower cholesterol, don't let grapefruit raise your risk. Blood pressure medicines. Drugs like felodipine and nifedipine and sometimes amlodipine. Here, grapefruit can drop your blood pressure too low. That means dizziness, fainting, or feeling like you stood up too fast. Not exactly the healthy fruit experience you're looking for. Heart rhythm medicines. So drugs like amiodarone and dronedarone. These are very powerful drugs. Grapefruit can push them to unsafe levels and trigger irregular heartbeats, which is exactly the very same thing you're trying to fix. Mental health medicines. So drugs like buspirone, which is used for anxiety. Some antidepressants, such as selective serotonin reuptake inhibitors, or SSRIs, like sertraline, which is the generic for Zoloft. These may all be affected by grapefruit. Also quetiapine, which is generic for Seroquel, which is used for bipolar disorders and schizophrenia. Instead of the gentle help that you're looking for, grapefruit can make the effects too strong or unpredictable. So imagine trying to calm down and end up feeling like you're on a roller coaster. Pain medicines like oxycodone and although rare but possible fentanyl patches. These are already strong pain meds. Grapefruit can make them too strong, leading to dangerous sleepiness or trouble breathing. Transplant medicines, and this is big. Drugs like cyclosporin and tacrolimus for people with organ transplants. These drugs are life-saving. Grapefruit can make their levels swing up or down, which is a big deal. Too much can harm your kidneys, and too little can risk organ damage and rejection. So definitely a no-go here until you talk with your physician or your pharmacist. Some HIV medicines and cancer medicines. The grapefruit interaction can be serious enough that it'll be written all over the warning labels on those medicines. Now here's one that's a little different. Allergy medicine fexofenadine, which is generic for Allegra. Grapefruit can actually make it work less well through a completely different mechanism. But unlike the medicines we mentioned above, you can actually avoid this interaction by spacing it out from when you eat grapefruit by several hours. Otherwise, think of it like paying full price for a medicine that now only works at half power. So it's important to remember, this list is not exhaustive. It's best to check if you start a new medicine and if you just gotta have that grapefruit fix, if there is an interaction. Another question I get is, how long should I avoid grapefruit and whatever medicine that you're taking that is affected by grapefruit? The answer isn't exact, but grapefruit can inhibit that enzyme for about 72 hours. So again, check with a healthcare professional if you have any questions. Now, before you panic and toss out every grapefruit in your kitchen, here's the good news. Not every medicine has this problem. Many are totally safe with grapefruit, and if you do take a drug that doesn't mix well, your doctor can usually switch you to something else. For example, if you take simvastatin for high cholesterol and that doesn't work with your grapefruit breakfast every morning, pravastatin might be fine. And it's not just grapefruit. Other fruits like Seville oranges, the kind used in marmalade, and pomelos and tangelos, they can cause the same type of issue. So read those labels, and when in doubt, ask your pharmacist. Here's the bottom line. Grapefruit is healthy. Medicine is healthy. But put them together, and sometimes the math doesn't add up. Always check before you sip. I'm Steve Borstein, doctor of pharmacy, and former hospital pharmacist. And hey, when life gives you grapefruit, maybe just trade it in for an apple or an orange, maybe a banana. Your medicine will thank you. Or you could just stop eating grapefruit. Since I don't like the taste, maybe that would be my first choice. Thanks for watching. If you learned something new today, give this video a thumbs up and subscribe for more health tips.